Welcome to this interactive section of our course. In this video, we will focus on role-playing, an effective technique to simulate treatment applications and practice applying the concepts you've learned in real-world scenarios. Role-playing exercises allow you to immerse yourself in the treatment process, enhancing your ability to assess, diagnose, and manage depression in patients. Why are role-playing exercises important? Role-playing is an invaluable tool in healthcare education because it allows you to practice key skills in a safe environment. By simulating real-world situations, you can enhance your communication skills, especially when discussing sensitive topics like suicidal ideation or treatment resistance. Build confidence in applying different treatment approaches to patients with varied backgrounds and needs. Practice problem solving and decision-making in a realistic context, preparing you for actual patient interactions. Let's begin with an example of a role-playing scenario. In this scenario, you'll take on the role of a healthcare provider who is assessing a new patient, Sarah, a 35-year-old woman presenting with depression and low energy. Sarah reports feeling increasingly hopeless and has been isolating herself from friends and family. She has been feeling fatigued and unmotivated, and despite having a previous history of depression, this is the first time she sought treatment. Step 1. Initial assessment. Begin by introducing yourself and making Sarah feel comfortable. Ask open-ended questions, such as, "I understand you've been feeling low. Can you tell me more about how you've been feeling lately? What changes have you noticed in your daily routine, like your sleep, energy, or appetite?" Make sure to approach Sarah's responses with empathy and understanding, and assess her mental state, including any suicidal ideation or self-harm thoughts. Step 2. Create a treatment plan. After the initial assessment, move into creating a treatment plan. In this role play, you may suggest the following. Medication. Prescribe an SSRI, such as sertraline, if Sarah's depression symptoms meet the criteria for moderate depression. Psychotherapy. Offer cognitive behavioral therapy, CBT, which is an evidence-based therapy for managing depressive symptoms by identifying and changing negative thought patterns. Lifestyle recommendations. Encourage Sarah to engage in physical activity, improve her sleep hygiene, and reconnect with her social support network. Step 3. Discuss treatment options. In the role play, you should also discuss potential side effects of medication and ensure Sarah feels comfortable with the treatment options. Reassure her that therapy and medication often work best together, and discuss how long she should expect to be on medication, setting a realistic timeline for improvement. Reflection. Questions. How can you build rapport with a new patient like Sarah to ensure they feel comfortable discussing sensitive issues? What treatment options are most appropriate for Sarah and why? Interactive Q&A, pre-test and post-test instructions. Before we dive into the practical application of these skills through role-playing, let's take a moment to assess your understanding of the material. You'll first complete the pre-test, which will help gauge your baseline knowledge, and then revisit the same questions after the course by completing the post-test to measure your learning progress. Pre-test instructions. The pre-test includes 15 multiple-choice questions, MCQs, and a self-efficacy Likert scale. The Likert scale will help us understand how confident you feel about applying the material covered in this course. Please complete the test digitally before the first session to give us a baseline understanding of your knowledge. These questions will cover the key symptoms of depression, screening tools and their use in diagnosing depression, different treatment strategies for depression, how to assess and manage treatment-resistant depression. Take your time with the pretest. Your responses will guide you in tailoring your learning experience, allowing you to focus on areas where you feel less confident. Post-test instructions. Once you've completed all course modules, you'll take the post-test. The post-test will include the same 15 MCQs and Likert scale questions, allowing you to compare your progress from before and after the course. This test will help assess your improvement in understanding and applying the concepts related to managing depression. We encourage you to think about the role-playing scenarios and practical exercises when answering the post-test. How confident do you feel now in your ability to manage patients with depression? Have your skills and knowledge improved as a result of this course? As we move forward with the role-playing exercises and case studies, remember that these activities are designed to help you practically apply the knowledge you've gained. Role-playing allows you to work through real-world scenarios, reinforcing the skills needed to assess, treat, and manage depression effectively in different patients. In the next section, we'll dive deeper into creating personalized care plans and fine-tuning your treatment approach for different scenarios. Let's keep it going, and I'll see you in the next one.